The first day that we came to Vanga, saw the hospital, went around and saw all the medical students and saw the residents and the nursing school. And at the end of the day, Kathy and I looked at each other and said, this is where we've been sensing God wants us to go. It's a teaching institution. It's a place where we can be about training and helping. And that was an amazing insight on the very first day. These are all patients that are waiting to be seen. They pay $3.50 for an office visit, and then they're waiting here for the nurse to get a history and see, oh, are they really urgent? Or can they wait till this afternoon when we have our normal clinic hours? This is our ICU ward. We've got a second ward here, and the good news is we do have a warmer for our newborns. It helps stabilize the baby's temperature. The smaller child is 1 kilo, 200 grams, and this child is 1 kilo, 600 grams. So we try to give them as much chance as they can to survive and grow. We're here in the emergency room where we have a number of patients that have been received in the last 24, 48 hours. What I'm going to do is work with our medical students and senior resident. There's so much multiplication that happens when you get people that are effectively trained. I mean, Jesus is a perfect example. I mean, he trained his inner group, he trained his 12, he trained the 70, and he sent them out. This is the parcel that we are planning to build new resident housing. We have increased the size of our residency, added 4 new residents this year, 2 of which are married and 1 of them has a child, and they're living in a 5-bedroom house. We want them to really get good, solid training, and so to be able to do that with their families, with them, is really going to be helpful. We have an architect that has visited a couple of times and put together a plan, and we're raising funds that can help house these residents as they're in their training. Jesus sent them out to preach the good news of the kingdom and to heal the sick. Luke 9:2. He came to heal because his kingdom was restoring what was broken. That's what we're about here, is restoring health, restoring wholeness. Those are the kinds of principles that we see happening here and we encourage with our doctors and nurses and administrators here at this hospital.